To perform the group manual muscle test for finger metacarpophalangeal joint extension, the patient is seated at the table with a forearm supported on the table in pronation. The wrist is in slight extension, and the fingers are held in a hook fist. The location of stabilization is kind of under the wrist and hand, so to stabilize the hand really well like that. The location of resistance is the dorsal side of the proximal phalanx, and the direction of resistance is into flexion. So I'm going to push into flexion, and the patient will be trying to hold in extension. So I want you to hold that there. Don't let me move that. Hold, 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 hold. Good. Now, this group test tends to show weak, as all finger extension group tests will tend to be weak compared to other motions and muscles in the body. So you have to test a number of people to get a good sense of what normal is like. We just did the group test for the index finger, and in the index finger, that group test is testing two muscles, extensor digitorum communis and extensor indices. You would do a separate group test then for the other fingers. For example, you would do a separate group test for the small finger, which would test extensor digitorum communis and extensor digiti minimi. Interestingly enough, for the middle finger and the ring finger, the group test would be the same as the individual test, since you only have extensor digitorum communis going to those fingers.